All right, so before we get started on some of the presentations, we really love to do something here at Visible Network Labs, which we call Visible Us. When we do webinars, you'll get a sense really quickly that we're very conversational. We like to hear from you. We like to put different kinds of little twists, I think, on the webinar that allow us to really put a human touch on it. And one of the things that we do is with our speakers, this section called Visible Us. So Rose is our presenter today in partnership with me. And before she presents, I think one of the things that we often miss in terms of our opportunities when we get to hear these presentations of work is to really understand who the person is, who we're hearing from. So Rose, if you don't mind, I'm going to take a minute before we even go on to just ask you to kind of introduce yourself. And what we try to do is always ask a couple of questions. And in those questions, we hope to just let our presenters tell us a little bit more about them. So Rose, I've had the opportunity to know Rose for a number of years when I met her as a student actually at the University of Colorado in the School of Public Health. But Rose, do you mind doing a little introduction? And then I'm going to ask you these two questions, and it won't be a surprise to anyone what they are, because I put them up here so we can all really know what we're going to learn from you.
Yeah, I'm Rose Hardy. It's nice to meet you all and see you all. I'm a network data scientist, as Danielle mentioned, here at Visible Network Labs. I've been here about a little over a year now.
Awesome.
Yeah.
All right, Rose. Well, I'm just going to get into it. So there's two things I was thinking about today, and this is about social connectedness. And one thing I've been curious about, and I want to hear you talk about, is what has been your professional journey to get here? What brought you into a place where you can study and think about social connectedness on a regular basis?
Yeah, so people that know me are probably going to be tired of hearing me talk about Montana and pediatric cardiology, but since most of you don't know me, I'm just going to go for it. So I grew up here in Missoula, Montana, and have been lucky enough to move back here relatively recently. My dad was the pediatric cardiologist for Western Montana for about 18 years before he retired. And as a result of, growing up here and seeing his work, I was able to see some of the joys and some of the challenges to providing pediatric specialty care in more rural communities. And because I saw that those connections and those relationships are particularly important, especially when sort of formal supports can be hundreds or thousands of miles away, it's really been an important focus of my work, and what made me interested in pursuing a master's in public health and then a PhD in health services research. And I've continued some of that work around pediatric cardiology specifically in my dissertation. Looked specifically at how young adults with congenital heart disease transition from pediatric care settings into adult care settings, and how their relationships between different providers can impact the success of that transition. And then from there, my postdoc work at Nationwide Children's Hospital continued to think about how the pediatric care setting and the places that we live and other social determinants of health can impact that care. And now here at VNL, thinking about how all those factors sort of impact our health and well-being.
Excellent. Well, I know, I mean, this is a selfish remark, but you can see why we're so pleased that Rose chose Visible Network Labs to come and work and share her passion for social connectedness, but also her expertise and skills around it. So you're going to get to hear a lot more about the work that Rose continues to do in that area in just a little bit. But before we do that, we also kind of like to know a little bit more, even more than your professional profile. So this question is, a lot of us have personal reasons that we come to mission-driven career paths. And so if you'd be willing, I'm wondering, have you had any experiences personally that have helped really frame the way that you think about social connectedness?
Yeah, for sure. I think like a lot of people that have pursued education for a long time, it means moving around a lot. And so building communities wherever you go. But for me personally, I have epilepsy. And so building that social support network has been felt particularly pressing in some cases. And so certainly it means some of the practical aspects of finding medical care providers in new communities. So you have access to the medications and the healthcare support that you need. But there are also some squishier things as well in terms of relationship building. Who do you tell about certain aspects of your life? So say, who needs to know that I could have a seizure and what to do in that situation? So certainly people like that I'm living with or sharing office space with need to know that. But what do the other people need to know, and how much do you want to share? And so those are the sort of calculations you have to make each time that you meet new people and build that community, and all of that impacts that community and that emotional and social support that you have. And then, when I came here to VNL, we get the chance to familiarize ourselves with the platform. And it was the first time I really got to visualize what that social support network looked like. And the first time that I also realized I never actually had a doctor ask me whether or not I had people that could help me or support me in times when, say, you change your medication and are there to check on you and make sure that everything is going all right. So it's sort of those experiences that I bring to this work and how we build community and connections.